This week, Stat published a remarkable feature on Robert F. Kennedy Jr.'s first 10 months as Health Secretary. Stat reporters Chelsea Cirruzzo, Casey Ross, and Sarah Todd spoke to dozens of people, 9 of which are directly in Kennedy's orbit. Their reporting provides a captivating look into RFK Jr.'s management style, his work habits, his relationship with the president, and more. I just spoke with Chelsea Cirruzzo about the story, but before we get to our chat, Status Report is Stat's new weekly video series. Every week, I'll be covering the biggest stories in medicine and featuring stat reporting like this incredible piece on RFK Jr. So please like and subscribe. It's a little click, but it's a big deal for us. Okay, let's hear from Chelsea. Hey, Chelsea, thanks so much.
Thanks so much for having me.
Your story has some amazing details about RFK Jr.'s management style and work habits. What's a typical day look like for RFK Jr.?
So in the course of my reporting, I learned that Secretary Kennedy, before becoming secretary, lived a very active lifestyle. He liked to hike, he liked to work out, and he continues to do all of that. It just has kind of melded into his professional life. So, for example, when he's traveling, he goes on hikes or he goes on fishing trips with health leaders and includes them in his day-to-day routine. I did speak with people who have observed him at the gym. He goes to local gyms in the DC area. He's often flanked by security. He definitely enjoys strength training, cranking out pull-ups, which we know from his Pete and Bobby challenge, which was a pull-up challenge he posted with Secretary Pete Hegseth. But when he gets into the office, the impression I got from people is that he is a very studious learner. He wants to read anything he can get his hands on. He wants to see old HHS reports and new ones, read articles. He's constantly asking staff, where are we on this? On day one, he really hit the ground running.
And what's his relationship with the president like?
Very close. And that's obvious both from what we've seen publicly as well as the private conversations I've had with people who know them. They speak almost daily over the phone. In public, we've seen that the president has referred to Secretary Kennedy very affectionately as Bobby, which is his nickname. He often pats him on the back. He often compliments him. He says, you've really done such a great job. Shortly after Kennedy faced criticism for some of his views on vaccines, President Trump said, well, he's a different kind of guy. There's a sense that Trump appreciates the unconventionality of Secretary Kennedy, but also appreciates his name. He once bragged to donors, I have a Kennedy on my side, which is a huge deal for a Republican president, given that the Kennedys are famously a Democratic family. So it's certainly a very close relationship and a very beneficial one for the president.
So RFK Jr. doesn't shy away from the fact that he's a Kennedy, but the president, it couldn't be further away politically from the Kennedys if he tried. What's that dynamic like?
Yeah, well, absolutely. Secretary Kennedy is very proud of his family, very proud of his name. He often starts speeches, and you'll hear this if you listen to him, with when my uncle was president, when my father was running for office, of course, referring to his father, RFK. And his office is even sort of like a monument to his family. Down this sort of long hallway leading to his personal office are campaign pennants related to President JFK as well as Secretary Kennedy's father, RFK. So he's definitely very proud of that, and that's important to him.
The Kennedys has a great legacy in the Democratic Party, and Trump is one of the most far-right presidents we've ever had. I'm just kind of curious about how he sees that dynamic.
Yeah, absolutely. And that's definitely been a contradiction. It appears even to his own family. It's clear that his own family does not appreciate or accept what he has done to align himself to President Trump and has called on him to resign. But there's a sense that I've gotten, especially talking with people who work closely with Kennedy, that Secretary Kennedy and President Trump seem to have this sort of understanding. And in fact, Kennedy's own family rejecting him and saying, we don't support him has really driven him closer to President Trump, who similarly feels that sort of sting of betrayal, who has many political enemies and feels like sort of nobody gets us, but the two of us, right? We know what it's like to come from a very powerful upbringing and to have these political enemies. So as far as Kennedy's concerned, I mean, he certainly believes his calling as a Kennedy is to do public service, and that's something in a long line of his family, of course. But he doesn't seem to see the contradiction that his own family does in terms of serving a Republican president. As far as he's concerned, his goal is to end the chronic disease epidemic. He said, I get down on my knees and prayed for 20 years that I get the chance to do this. And President Trump gave him that chance. And so it doesn't matter the party affiliation. It's really about getting the opportunity to do what he wants.
Are there similarities between how RFK Jr. and Trump kind of approach their jobs?
Mm-hmm. Yeah, I found in the course of my reporting that much like Trump, Secretary Kennedy values loyalty and demands it of his staff. So, for example, he hired David Geyer, who is a known vaccine skeptic who has continuously linked vaccines to autism, despite evidence suggesting otherwise. He hired him in March to gain access to the vaccine safety data link, which he had previously had access to, and that was revoked because it was believed he was using it to manipulate the data to say that vaccines cause autism. Geyer is now back in HHS, and when he came to CDC to take a look at that data, CDC officials did not want to give it to him because they felt as though he would, again, use it inappropriately. Kennedy did not appreciate that. He sent his a deputy chief of staff at the time down to Atlanta to sit down with CDC officials and make sure that Geyer could get the data that he wanted him to have. And of course, a more drastic example of this is when he hired CDC director, Dr. Susan Menarez. She was fired about a month into her job. And both of them, differ in what happened in their conversations. She says they disagreed on vaccine policy, and he says he asked her if she was trustworthy, and she said she was not. I mean, it's so clear that he demands this trust, this loyalty to his ideas, and if he doesn't get what he wants, he gets rid of those people, or he, uses his close allies to make sure it happens.
So some in the Trump administration were kind of leery of RFK Jr. at first, and is that right?
Mm-hmm.
10 months later, it seems like things are going pretty well. What kind of change? What did RFK Jr. do to kind of win them over?
Yeah, that's a great question. So early on, again, Kennedy comes from a Democratic family. He has a unusual background. He's a very divisive figure, and of course, President Trump can be as well. But introducing someone else like this into the administration definitely had. There are people who had concerns about that, and in particular, there were concerns this spring when a couple of things were going on. There was a measles outbreak in Texas. And Secretary Kennedy sort of, flip-flopped on his messaging. He didn't at first outright say vaccination is the best way to prevent measles, which is true. He, talked a lot about parent choice. He pushed unproven treatments, including vitamin A, which can cause toxicity if taken too much. Before finally saying that vaccination is the best way to prevent measles. So that was a awkward couple of weeks there. And then on top of that, he was chosen to lead the Make America Healthy Again Commission by the president. And they put out their first report in the spring. And it very quickly became clear that citations in the report did not exist. The White House and HHS said that was because artificial intelligence was used to generate citations, and the AI ended up creating fake citations. But the White House, some members of the White House, I learned in the course of my reporting, did not appreciate this. They felt like that was messy. It didn't look good. So they were really concerned about Kennedy moving forward. Now, what has since happened is that Kennedy and Trump on their health priorities seem to have gone to their own corners and re-established their priorities. So for President Trump, that has been drug policy. And this is something he's been passionate about since his first administration. He has been making deals in the Oval Office with drug companies to lower drug prices with Kennedy beside him. But of course, it's been led by President Trump. And then meanwhile, Kennedy has been leading a lot of the public health policy, including vaccine policy, with Trump's backing. So that means Kennedy might say, or might say, we're changing the way childhood vaccines are recommended, and Trump will say, that's great, I support him. So they've kind of gone to their own corners with each other's backing.
So Daniel Jernigan, who's a 30-year veteran of the CDC, who just recently resigned, said that RFK Jr.'s process has, quote, moved from evidence-based decision-making to decision-based evidence-making. What kind of decisions is he referring to there?
Yeah, there's definitely a few things here. I think probably first and foremost is the Advisory Committee on Immunization Practices, which is the federal vaccine advisory committee that tells the CDC and then the secretary which vaccines people should get and why. They previously used this evidence-based framework, which means they are not saying that vaccines don't have risks, but they're saying, do the risks outweigh the benefits of making sure people get this vaccine? Kennedy has completely wiped the slate on that panel, and he has brought on his own handpicked panel of advisors who have taken a different approach. They say, of course, it's evidence-based. They'll say that's the way it is, but it's clear a lot of them have views about vaccines, are skeptical of vaccines, believe that certain childhood vaccines should be delayed or given in different doses that are impacting how they are putting out their recommendations. So that's certainly one. The other one is the Tylenol press conference. That was a really big moment where the president urged people, pregnant women who are expecting or have young children, not to take Tylenol or to give their little children Tylenol. Otherwise, they're at risk of developing autism. There's very limited evidence that ties Tylenol to autism. But Kennedy has made these big promises that he will find out why autism rates have gone up. And, they had this one study from Harvard that suggested a link, and they went with it, right? So there was this big press conference, but evidence is really still lacking to prove that. But at the end of the day, when you have the president and the top health official in the country saying, don't take Tylenol is linked to autism, then you will hear that as the truth, right? And of course, there's still evidence that needs to come out on that. I will note on that, Kennedy has since backed off a little bit and said, we don't necessarily say Tylenol causes autism. There's still work that needs to be done. But truly, when you look back at these moments where the president's saying it, the health secretary is saying it, then it does impact what people think.
So you and some other stat reporters dug into RFK Jr.'s X feed, specifically one week in August. What did you find?
Mm-hmm. Yeah, this was the week that started with him making an announcement that the United States would no longer fund certain research on mRNA, which is the technology that was used to create COVID vaccines. What we found, and I really have to credit my colleague Casey Ross on this, what we found is that he relies on science but misrepresents what it's saying. So he will say a study has found this, or, we know this about viruses. But then when you really drill down on what he was saying, he didn't represent exactly the truth of that study. So for example, in the video on mRNA, he says
mRNA only codes for a small part of the viral proteins, usually a single antigen. One mutation and the vaccine becomes ineffective. This dynamic drives a phenomenon called antigenic shift, meaning that the vaccine paradoxically encourages new mutations and can actually prolong pandemics as the virus constantly mutates to escape the protective effects of the vaccine.
We do know that viruses mutate, but to say that vaccines cause them to mutate, public health experts say that's not true, and that's misinformation. Of course, it sounds like it is true because it's backed by science. He really does draw on a lot of studies and papers, but again, misrepresents what they're actually saying, which can be confusing to the average viewer.
So Secretary Kennedy also made some claims about teenagers and sperm counts, and what was that all about?
Yeah, so he made a video where he talked about how first of all, Americans are sicker than they were than ever, and that young men and boys have declining testosterone and sperm counts than people their age years ago. Of course, there are some studies that maybe suggest that sperm counts are declining, but this, particular claim that he made doesn't differentiate between adults and teenagers. He references a study, but again, misrepresents it. And of course, it doesn't differentiate the fact that over time, as people age, their testosterone or sperm counts decline. So it's just another example of taking a research paper, taking a study, and sort of twisting what it actually said. So that is what happened there.
He also used some numbers about fentanyl deaths in kids that weren't accurate. Is that right?
Yes, that's correct. So he said that 106,000 children died of fentanyl overdoses 2 years ago. Again, this is an example where there's a morsel of truth in that. But that number is accurate, but it has to do with overdose deaths from all substances for all ages, right? So again, that number is true, but it is not accurate in how he's representing it.
Kennedy made some assertions as well about why doctors are vaccinating children. What did he say there?
Mm-hmm. So he claimed that doctors are paid to vaccinate kids, and therefore it's a money-making scheme. Truthfully, the American Academy of Pediatrics tells us that vaccination is actually a money-losing scheme for doctors. It's expensive and it does not get them any more money. But it really tracks with this long-standing skepticism that Secretary Kennedy has of the medical profession. This isn't the first time he's accused doctors of acting to keep people sick or to make them sicker in order to inflate their profits. So that is just a sort of theme that he's had. The other thing is that sometimes he uses these social media videos as sort of a precursor to an announcement. He made a video that said autism rates are going up and, once again, pointed fingers at doctors saying that they are getting paid to keep Americans sick. Shortly thereafter, that press conference on Tylenol and autism. So you can sort of get a hint of what his plans are from these videos and from the way he's representing data to sort of see where he goes policy-wise.
By and large, the nation's health experts seem to disagree with RFK Jr. on a lot of things. But one thing they do tend to agree with him on is his interest in steering Americans away from ultra-processed foods and sort of overhauling the food industry, with the Americans' health in mind. But he's in an administration that isn't exactly fond of government regulations on businesses. So without having regulations as a really viable tool, what tools does he have to influence Americans' diets?
Yeah. Certainly the bully pulpit. It's a really big pressure campaign. And that is certainly the Trump way, not just not regulating, but telling companies to do what they want. And so when it comes to food, he has put a lot of pressure on companies to remove food dyes. Of course, when they do that, they get celebration from the secretary. They're shared on his X account, and he's saying, MAHA win, great job to this company or that company. So it's a lot of pressure and praise when these companies do what he says. And the other half of this, and credit to my colleague Sarah Todd on this, is that a lot of nutritionists, like you said, don't say that's a bad thing. They do support that. Of course, the other side of that is they don't feel like Secretary Kennedy has focused on food safety as much. So when it comes to, preventing illnesses in food, he's a big fan of raw milk. And we know that raw milk can carry diseases like salmonella, and it can be unsafe for you to drink. So there's this weird balancing act that I think a lot of nutritionists are optimistic, but also feeling like, hey, wait a minute, there are a few things here we need to not forget.
RFK has become maybe a little bit of a celebrity around DC. Like, what's his DC life like?
Mm-hmm. Yeah, he has been spotted out and about in the DC area. He owns a house in Georgetown with his wife, actress Cheryl Hines, and he is a frequent guest of a restaurant actually near him called Martin's Tavern. Martin's Tavern is interesting because it actually does have Kennedy lore built into it. It's where President JFK proposed to his wife, Jackie. So there is a booth dedicated to them. The owner told me that Secretary Kennedy actually prefers to sit in another booth called the Madeleine Albright booth, which was a popular one of hers. In addition to that, I mean, he spends a lot of time with his family. He often posts photos of him and his grandkids hiking in Rock Creek Park, which is a park in the middle of the district. Famously, or perhaps infamously, they posted a picture of them swimming in the Rock Creek, which is not recommended, given that it serves for sewage runoff and is not considered safe. Other things he's been spotted doing, he of course goes to the gym a lot. He has been seen at a tanning salon in a neighborhood in DC, though it's not clear if he does spray tans or he is in a tanning bed. But you know, he is certainly a fixture in this area, and you know, which can be interesting given that you know, we're used to seeing politicians, but seeing a Kennedy who's pretty well known for more eccentric things, like, you know, he has been at the center of headlines related to dead bears in Central Park and brainworms. It can add a little bit of flavor to the city.
Chelsea, I enjoyed reading your story so much, and thanks for coming on.
Thank you so much.
Thanks again to Chelsea. Be sure to check out the full story on statnews.com. And again, if you enjoyed this video, please like and subscribe. It's a little click, but it's a big deal for us. And we'll be back next week. Same stat time, same stat channel.